Hello, I'm Dr. Nebal. Today we are going to discuss a case scenario for the fifth. It is a real life case scenario, and we will discuss the history, the history taking. And how to examine neurologically, just tips of a neurological examination for this case. We are going to follow, or we are going to be guided by the slides, and at each section of the history, you will find the history or the story or the results of the story of this child written in each slide. So we will start. Let's start with this case scenario. Salim Ahmed is a 2-year-old boy living in Hilla. The date of admission is the 12th of June, 2019. The date of taking history is the second day or the following, the next day after admission, 13th of June, 2019. The history was taken from the parents. The chief complaint of the child is recurrent attacks of abnormal body movement since age of 9 months. So we have two sections for the, actually the history of a neurological case is just the same as the history for any case in pediatrics. The first section is the demographic section, the name, age, gender, the residence, the date of admission, date of taking history, the historian or the informant, this is very important, are they the parents, one of the parents, close relatives, and the guardian. You should know the guardian. Here in the section we can add school level in a school aged child, and we can add sometime blood group. And then the chief complaint. Now I'm asking the parents, what is the chief complaint of this child? على مود شنو جبتوا ابنكم? And the answer was recurrent attacks of abnormal body movement since age of 9 months. Now, sometime we can use, if they say they are fits, إذا قالوا لك هذه الشمرات, you can write fits. This is a public term. If you have recurrent episodes, whether fits or any other types of episodes of headache, episodes of vision loss, episodes of abnormal body movement, you can, and these occur in certain number, in a specific number over a period of time, then you can say recurrent attacks of abnormal body movement since age of 9 months, يعني صار لها سنة و3 أشهر. But the duration of each episode and the other details will be considered and will be obtained and talked about or discussed in the history of present illness. فهذه كانت أول 2 sections من history taking. And then the history of present illness. And you can see this scenario. It's a conversation between the parents and the doctor who is sitting in front of them taking the history. The parents, we noticed that our baby is not like other peers. He is unable to sit, stand or walk. هذا اللي قالوا الأهل. الآن الدكتور first they discussed or they told you that told the doctor that the main problem is the recurrent attacks of abnormal body movement, and now they thought that all additionally the child has problem in his development, but you are going to guide the parent to guide them back to the chief complaint. You want to listen to more details about the chief complaint. So the doctor say, okay, we will discuss these concerns later. Could you please tell me more about these episodes of abnormal body movement? The parents answer, yes, they started at age 9 months, during which he has startle-like episodes, as if he forcefully jerks, bending the arms and head forward, followed by screaming. This may recur several times, and he seems discomfortable and unresponsive. Of course, I have to stop here and tell you that it is not always as easy as this when the parents can describe the details of the episodes or even the details of the history. But it is not always as easy as this, but sometimes you can obtain such detailed information, and you can sometimes guide the parent to tell you this information, even in the history of present illness. But try to reduce your interruptions to the parents. Listen to the story. The doctor asked while listened, was there time a predilection for these episodes? Parents, yes, often near sleep time, when he is falling into sleep or upon awakening. يعني تزداد الابيسودز لما الطفل يريد ينام أو يريد يقعد من النوم قريب من وقت النوم. Parents continued their story, and anti-seizure medications اللي هو Dipakine was prescribed 1 month after onset of episodes by his physician. Here I write valproate and Dipakine. We try to either listen to the name of the medication mentioned by the parent, or you can ask to see the drug bottle or the drug sheet, or sometimes the parents are preparing everything in front of you and tell you this is the first drug. These episodes responded partially. His condition worsened, and the attacks increase in frequency, and our child is not behaving well. The doctor, how frequent they occur recently? The parents, they occur 7 clusters. He has 7 clusters. يعني عنده الاتاكس تحدث بمجاميع clusters. المجاميع تحدث حوالي 7 مرات باليوم, and in each he startles يجفل 25 مرة في كل مجموعة. And 2 months ago, another doctor prescribed another drug additionally. The parent told the doctor Rivotril, and the scientific name of that is clonazepam, which again showed benefit initially by reducing the episodes frequency, but after 1 month of using the drug, the attacks resumed the same severity as before starting the drug. هذه هي القصة اللي استمعنا لها بالhistory of a present illness من الأهل. The date of admission كان yesterday. Today is the date of taking history. They told you the history, recurrent attacks of abnormal body movement. They described these attacks. They told you the sequence of the clinical course of the child, and they told you the action that was taken for this toward this illness. First, valproate was started, and what happened after starting valproate, and again, Rivotril was added 2 months ago. Now, from the previous conversation, the doctor tried to guide the parents talking about the main topic, the duration and the sequence of the events. Then, and how we try to reduce the interruptions you try to listen. لكن بعض الأحيان تحتاج إنه تقاطع الأهل حتى توجهها مرة ثانية للقصة. He tried to postpone discussing the details of the child development إلى development section. حاولوا أنهم يتحدثون عن إنه ابنهم ما يشبه الآخرين, لكن الطبيب حاول يرجعهم إلى المرض الأساسي. The parent may mention brand names. You can ask them to show you the bottles, to show you the sheets, the tablets, whatever the brand product looks like, and you can write it. And you can, read that product. As the story was told by the parents, more details were requested by the physician but need to be obtained in the review of system. Now, the physician has many questions, but he cannot, or he tried to avoid interrupting the parents. He listened to the story and he will let or leave all the questions in his mind to the section of review of system. فنيجي على section now. This orange filled or orange highlighted text هذا يمثل other review items بالreview of system regarding the description details of seizure, وهذه ممكن تحصلون عليها من محاضرة seizure epilepsy in children. other neurological، بما انه احنا بالريفيو اوف سيستم فنحاول انه نكمل الجهاز العصبي، نكمل الاذر ايتمز اللي لازم نسال عنها، لان هو هذا المين system affected or insulted in this child. ايضا نكمل بقيه review of system، الدرماتولوجي، الجي اي تي، الجاسترو، الجينيتورينري سيستم، هيماتولوجي and psychiatric problem. هذه طبعا نحاول انه نركز على امور خاصه or related to the case. Just before إذن هذا نتحدث عن هذه ملاحظاتنا عن ال history of present illness، والorange highlighted text هي الملاحظات عن ال review of system. But I would like to mention here that, or to remind you that before ending the history of a present illness, try to ask about 6 important items: sleep, activity, weight, urination pattern, bowel motion, and body weight. Then we go on to the prenatal, antenatal, postnatal history. Now, in this child, the information obtained were the child or the mother had gestational diabetes mellitus. The child was a product of cesarean section. He had shortness of breath immediately after birth and increased breathing activity. And the doctors told the parents that his blood sugar was measuring low. He was admitted to the NICU for 13 days. Let me remind you that this is a real life case scenario. هذه المعلومات اللي حصلتها من الأهل، لكن إحنا ideally أو formally نسأل على معلومات أخرى مهمة أيضاً قد نحصل نتيجتها أو جوابها وقد ما نحصله. هذه المعلومات هي fetal movement, any abnormal fetal movement, congenital anomalies seen by the ultrasound, especially of the brain, drug intake, X-ray exposure, toxins, cigarette smoking, alcohol intake, birth process, gestational age, birth weight, length, and OFC if available, Apgar score, postnatal event like breathing, etc. إذن إحنا بدنا نحكي في كل section من الهيستوري نتكلم عن formal information that we should ask about، ونتكلم عن information أيضاً that were obtained for this child. Past medical and past surgical history. For this child, he had once at age of 3 months, shortness of breath and fever that necessitated hospitalization. There, the oxygen was applied and intravenous medications were administered. He stayed for six days, improved and discharged. Now, in the past medical history, you should ask about many things. You, including, ask about the results of the tests, whatever the test. إحنا بالنسبة لنا بالنيورولوجي تسأل عن the results of neuroimaging، تسأل عن neuroimaging to which part of the nervous system, the brain, the orbit, the family. ممكن تنطينا معلومات، ممكن تعرف. نسأل عن الالكتروفيزيولوجيكال، وإذا ممكن إذا مو نسأل عليها فقط كأجوبة شفهية، ممكن نطالب بإعطائنا الفحوصات ونتائجها حتى نقراها. ممكن كثير من الأهل أو من الكير جيفرز يكونون جايبين وياهم الفحوصات. الفاميلي history. You should ask, let's talk about the formal, the ideal way or information that should be taken in the family history. هذا بالorange highlighted part of this slide. هنا تسأل عن الconsanguinity، هل هم أولاد عم، هل هم first degree cousin، second degree cousin، هل هم siblings، number، ages، school performance، health status، development of his siblings, systemic illness in the family, similar or other disorders, death in the family. الdeath والabortions ممكن تسأل can be missed, so you should focus and ask about them frankly, about parental health, about other relatives. ممكن الفاميلي هيستوري يكون غزير لكن مو بالfirst degree relatives وإنما بالother relatives, remote kins. فالفاميلي history that was obtained in our child was as follow. انتبهوا لي الفاميلي history لهذا الطفل. Positive consanguinity, the parents are second degree cousins. He has two healthy siblings who had delayed milestones, then improved. You may need more details about this. He has an aunt an aunt from the paternal side, يعني العمة, who had psychomotor delay and she died at age of 35 years. He has two girl cousins. عنده بنات عم أو بنات خال, I didn't specify, 16-year-old, 8-year-old who have psychomotor delay. He has two aunts alive, بعدهن عايشات, and mentally retarded, and his father's cousins يعني women cousins بنات عم الأب has epilepsy, and 3 cousins also or 3 children, a woman يعني بنت عم الأب عفواً عندها صرع and has 3 children, not cousins but children with this morphology and mental retardation. So you can see that you have many generations. You have cousins, you have the aunts, but most are on the paternal side. يعني كثير من أفراد عائلة الأب مصابين. بنات عم الطفل، عمة الطفل متوفية، عمات الطفل 2 مصابات mentally retarded، وبنت عم الأب أيضا. إذن هذه مهمة. And you can go further into the to ask about the grandparents, consanguineous marriages مالتهم، هل هم أقارب أو لا، وعن أطفالهم أيضا. Social history, you have to ask about, this help us identify risk factors like exposure to poverty, violence, parental depression, and bullying. كل هذه ممكن presented أو ممكن تكون risk factor for neurological disorders. Developmental history for this child. The child is 2-year-old and he's unable to roll, sit, or crawl. Sometimes he can make cooing voices. He has no hand grasp. He's unable to fix and follow. ممكن يكون عنده visual impairment, and he may show subtle response to sounds by some listening behavior. ممكن يصفن إذا سمع صوت، ممكن يدور وجهه، ممكن staring يبحلق بعينه إلى آخره. فهذا هو developmental history. So we involve the 4 domains: the gross motor, fine motor, vision, fine motor, and hearing, speech, and social. We have to assess the presence of developmental delay, global or specific. You have to ask about the onset of the development, the timing, the progression, if there is a delay at birth or early in development, if there is delay in infancy or childhood, the personality and everything, the development before and after the illness. يعني هذا الطفل عنده period of development أول 9 أشهر من عمره. Then since age 9 9 months spasms or neurological problem started. ومن 9 أشهر هسه عمره سنتين، إذا عندي developmental stage قبل ال9 أشهر و developmental stage بعد ال9 أشهر. Drug and vaccination. This child has no remarkable drug history apart from the drugs that the chronic drugs prescribed and taken for his current illness, but he is fed semi-solid food because he's unable to chew food particles and usually experience choking with the fluid or solid food particles. So he is unable to be fed the usual table food of the family, and he was vaccinated partially. هذه كلها إلها تداعيات وإلها clinical significance. لما تقول لي الأم الطفل is feeding is fed semi-solid food، إذا ممكن نتوقع بعمر السنتين مدى ياخذ الكميات والأنواع الكافية من المواد الغذائية، وبالتالي نتوقع nutritional deficiency state، وهذه راح تكون لها additional negative impacts على الطفل. ثانيا هذا بحد ذاته هل feeding difficulty may indicate bulbar problem، وممكن تعطينا فكرة عن neurological severity of his neurological illness. Now we finished this case scenario, the history taking، وعلقنا على كل part أو section من الهيستوري. هسه نتحول إلى tips on examination. راح نتعلم أو نتعلم خطوات بسيطة لفحص العصبي لهذا الطفل في مرحلة الصف الخامس. We are trying to give you simple and tips or outlines about a neurological examination. Most of the neurological examination or findings obtained in the pediatric neurological examination is done at the inspection part, is done by inspection. Okay. طبعا احنا التبس اللي عندنا هي first of all you are going to stand nearby the child, just try to stand away, slightly away from the child, just to have a good look for the child. Look at his consciousness or inspect his consciousness, his orientation, his alertness, the severity of his general status of the child. Either ask the child is coming walking toward you or walking in front of you، بالتالي تقدر ورا الكونشيسنس تفحص الجيت، أو إنه الطفل lying flat and you can postpone the gait to the end of examination. When lying flat, you have to look at the postures of the child. Listen to the child, talk to him, or listen to his voice, listen to his crying. Measure the respiratory rate, the temperature, the blood pressure, and look at two signs of respiratory distress. The colors are important: pallor, jaundice, or cyanose. Apologize for this grammar or text writing faults. Dysmorphology, very important. Look at the child if there is dysmorphological problem or features in his face, in his head, in the hands, in the genitalia. هاي كلها dysmorphic feature. These are very important. They may give you an impression about or idea about syndromic problem that can be presented with the neurological disorders or features. Expose the child and look at his skin. Look at search for any birth markers. جدا مهمة هذه بالneurological disorders. Look or at inspect the child for any abnormal movement like myoclonus, clonic, dystonia, chorea, and others. Abnormal posture of the body or the limbs. For example, a child fisted his hands, which may indicate hypertonia or spasticity. Flexed arm and flexed wrists. This may indicate again hypertonia, spasticity, or may indicate if they occur or they are seen on one side of the body. It may occur in hemiplegic child. Look at any twisted posture of arm, frog, or leg posture like crossed legs. Look at the hair, the color and texture and nails. دائما dermatological signs مهمة جدا بالneurological examination. Look at the head shape and fontanelle, body build, and the other items are the same. لكن التبس المهمة إنه الريد red colored text here items that can be inspected without touching the child. Now, for detailed examination of a neurological system, refer to the detailed hand sheath neurological examination in children by Dr. Nebal Wail, وممكن تجدوها في مكتبة الكلية. Child's examination. هسه نشوف احنا من فحصنا هذا الطفل شلون وجدناه. The child, by inspecting the child, he was found conscious but not alert. Alertness يجي من the child's response to the other, response by his eyes, response by his voice, by body, by gestures, by body movement. يعني ممكن ينظر إلك ويشوفك غريب يستغرب منك ويبكي، معناها he's alert to you. أو ممكن يشوف والده أو والدته ويضحك يبتسم لهم، معناها he's alert to the surrounding. He has this morphological feature: deep-seated eyes, maxillary protrusion, left eyelid coloboma, low-set ear, high-arched palate, and one coffee-olate spot on the left loin. He was not pale nor cyanosed or jaundiced. He had normal breathing function and respiratory rate was 25 breaths per minute, and he had no respiratory distress signs. He had normal body build, normal hair color and texture, normal head shape and size, no abnormal movement, no abnormal posture, normal genitalia, normal muscle bulk, and there was paucity of movement of limbs. So the most important thing is that he was not alert. He's conscious but not alert. He has this morphological features of the face mainly, and he has paucity of movement of the limbs. يعني الطفل راقد وقليل الحركة للأطراف, which may indicate motor problem and may explain his developmental delay. So we come to the end of the history taking and neurological examination tips. Thank you very much.